All right, let's dive into a really fascinating clinical showdown in the world of fertility science. When it comes to frozen embryo transfers, there's always a big question. Is it better to trust the body's natural timing or use a doctor's schedule? Well, a brand new study gives us some pretty surprising answers. So here's the central question, right? For a frozen embryo transfer, are you better off letting the body take the lead with its own timing or using medication to pinpoint the exact moment for ovulation? That's precisely what this big, randomized, controlled trial set out to figure out.
Before we get into all the nitty-gritty details, let's just simplify the main goal here. It is all about timing. For an embryo transfer to have the best chance of working, the lining of the uterus, think of it like a cozy nest, it has to be perfectly ready for that embryo to arrive and implant. Getting that timing just right is the whole ballgame.
Okay, so this brings us to what is really a tale of two different cycles. The study put two very different approaches to the test to see which one could get that timing right. So let's meet our two contenders.
So on one side, you have the spontaneous approach. This is where you just wait for the body's natural luteinizing hormone, or LH, to surge. That surge is basically nature's green light for ovulation. Then on the other side, you have the modified approach. This one uses an injection of a hormone called HCG to manually trigger ovulation at a very specific scheduled time. So really, it's a classic matchup, nature's clock versus the doctor's calendar.
Now, of course, to get an answer you can actually trust, you need a fair test. So how exactly did the researchers set up this medical showdown to make sure the results were totally reliable? Well, they used what's called a randomized controlled trial, or an RCT. And this is truly the gold standard in medical research. What it means is that patients were just randomly assigned to either the natural surge group or the trigger shock group. And that randomness is absolutely key. It helps get rid of any bias and makes sure the results are as clean and trustworthy as possible.
So who actually took part in this study? All told, there were 108 patients, and they were split right down the middle, 54 in each group. They were all between 18 and 39 years old. They all had regular menstrual cycles, and every single one was undergoing the exact same procedure, a single frozen transfer of a day 5 blastocyst. This is really important because it means the results are most relevant to patients who fit a similar profile.
And here's what makes for a fair fight. For this whole comparison to mean anything at all, the two groups of patients had to be as similar as possible in every single way except for the one thing they were testing, which in this case was the method for timing ovulation. And this slide right here shows you just how well they did that. Look, the average maternal age, BMI, and even those key ovarian reserve markers like AMH were incredibly similar between the two groups. Even the reasons people needed IVF in the first place were distributed pretty evenly. This tells us the playing field was perfectly level, so any difference in the outcome is probably because of the treatment itself.
All right, the stage is set. The test was fair. So what happened? Let's get to the results. After all that careful prep work, which cycle protocol actually came out on top?
First things first, we need to know what they were measuring. The primary outcome, that's the main yardstick for success in a study like this, was the positive pregnancy rate. It's pretty simple. What percentage of embryo transfers actually led to a positive pregnancy test?
Okay, moment of truth. For the group that went the natural route, relying on the body's own LH surge, the positive pregnancy rate was 35.2%.
And what about the group that used the HCG trigger shot? Their rate was 31.5%. Wow, those numbers are incredibly close. So here's the crucial takeaway. When the statisticians crunched all the numbers, that difference between 35.2% and 31.5%, it wasn't statistically significant. What that means is, based on this study, one method was not really superior to the other. When it came to the main goal of getting a positive pregnancy test, it was basically a tie.
And this is where it gets really, really interesting. If the pregnancy rates are pretty much the same, does the choice even matter? You might think, well, no. But the researchers looked a little deeper, and they found a huge practical difference between the two approaches.
And boom, here it is. This is where we see the big twist. The group that relied on their natural cycle needed a lot more clinic visits for monitoring before their transfer could happen. This was way higher compared to the group that used the scheduled HCG trigger. So, let's put all this together. What does this data actually mean for patients and for doctors who are trying to make these really important decisions about fertility care? The study's own authors summed it up perfectly. They said their results support comparable efficacy between the two methods. In other words, when you're talking about the ultimate goal, achieving a pregnancy,
It seems like both paths are equally good at getting you there.
So let's just break down the key takeaways here. Number 1, pregnancy success was similar. Check. Number 2, the trigger method meant way fewer clinic visits. And this is a huge deal, right? Fewer visits can mean less patient burden. We're talking less time off work, less stress, and of course, lower costs. The big point here is flexibility. This study shows that doctors and patients can now choose a protocol based not just on success rates, but also on what actually works best for a patient's life. The authors even hint that this could have some major economic benefits, which is a massive consideration in healthcare.
And that really leaves us with a final thought to chew on. When you have two treatments with pretty much the same success rate, but they have very different demands on your time and energy, maybe the question isn't which one is better anymore. Maybe the real question is, which one is better for me? This study really suggests that in fertility care, the best protocol might just be the one that works for you, both medically and personally.